Well, I've been an adolescent medicine specialist for about 20 years this year, and that means that I've really gotten specialty training. After training as a pediatrician, I got 3 more years to train as an adolescent medicine specialist to see people 10 to 24 around issues that really pertain to adolescents, young adults, like substance use, eating disorders, obesity, school failure, depression, anxiety. Those are areas that I focus in more. And so over the last 10 years, it's become very clear to me that one of the areas that needs more focus is substance abuse. And here, since moving here 7 years ago to Seattle, I started a substance abuse program here, really focused on kids who have co-occurring disorders, meaning kids who have a substance abuse problem and a medical problem, and a mental health problem. There aren't a lot of places for kids like that, and we are able to really give some specialized high-intensity services. The whole reason I see kids is because their parents are bringing them, and usually they're bringing them because there's so much stress and pain that's already happened in the household. Stolen things, kids getting picked up, and they have to go to court, or they have to fight to get them back in school because they've been expelled. And they're bringing them in saying, well, maybe it's the marijuana. And the young person says, I'm not going to go to treatment. It's not that. I'm going to continue to use. And parents sometimes not really knowing how to now pull back and say, no, you can't use marijuana. I don't allow it in the house. Sometimes it's very difficult, and you see the families just go through so much pain. Eventually, they usually do get to the point, parents do, where they have to send their kids for treatment. But sometimes there's a lot of pain before it, and a lot of, sometimes parents disagree. And one parent will say marijuana's fine, and the other parent says, but it's devastating his life. And, again, it causes a lot of disruption in families. 1 in 6 kids who use it like weekly or monthly are going to become dependent on it. It's very different from adults, where 1 in 10, it's a 10% chance you might become addicted if you use marijuana. It's much higher for kids. And it's because the reward center, the front part of their brain, all the areas that talk about emotion regulation and memory, all those areas are still being developed. And you put the marijuana there instead of the chemicals that should be there, and your brain's going to start asking for them because they release so much more good feelings and dopamine in the brain. Your body's going to keep wanting to take you back. So it's important to understand that it is addictive. Not everybody gets addictive, but not everybody gets addicted to marijuana, but it is an addictive substance, and there's no question about it. I think, when parents are parenting, I would hope that even before they would see somebody like me who works with teens, that they've begun to talk about this with their kids in 5th, 6th grade. Some of the kids that I've seen with the worst addiction started at age 10, 9. So it's important. It's not just a teen thing. It's important to, it's important to give the values of your family throughout them growing up. At the stage that they can understand it, you begin to tell them what they can understand about what you believe about drugs and alcohol. You begin to look at how you're using drugs and alcohol, and if they're seeing you use them because you're tired, because you want to go to sleep, because you want to have fun, that's the message they get at 8, 9, 10, 12. So you want to look at that and decide, what is it that I'm doing? How does that impact what my child will do? And is that what I want my child to do as well? And then sit down and have many messages. Alcohol and marijuana use is everywhere. So you can use what you see to have teachable moments at any time, but always being consistent about what you want for them and what you see them doing and what the consequences are, natural or parent consequences, for the family about use.